Hello all. We are going to lecture today on chapter 28 is nutrition. So you can find this on page 934 is where it's going to start. All right, so nutrition. What is nutrition? It is the study of how food affects the body and the health. Okay. Another word that you may find sprinkled throughout this chapter is going to be metabolism. So metabolism is different than nutrition. Metabolism is the process of the body converting food into energy. Okay, so nutrition is what we eat and how it affects our body and our health. Metabolism is what our body does with that food once we eat it. Well, it takes that food, it sucks the nutrients out of it, and it delivers it to other parts of the body that need it for energy. Okay, so that's metabolism. Adequate nutrition is essential to wellness. Okay, food can affect us in a variety of different ways. So we'll go over a couple of definitions here. So dietary reference intake. So you don't really need to know a ton of stuff about this. You just need to know the difference between them, kind of what they are in general. Okay, so estimated average requirement, or EAR. So this is the amount of a nutrient that is estimated to meet the requirement of half of all healthy individuals within a given age group. Okay, estimated average requirement. It is the average, essentially, the average amount of a nutrient to meet the requirements of the body in a given age group. Okay, that's your estimated average requirement. Recommended dietary allowance, or RDA. So this is the average daily dietary intake of a nutrient that is sufficient to meet the requirements of most people. Okay, so this is about an individual nutrient of some kind. So your recommended dietary allowance of protein is blank, whatever. Adequate intake, or AI. So this is the amount of a nutrient that is consumed by a group of healthy people. Okay, adequate intake. Tolerable upper intake level, or UL for short, is what they use. This is the maximum daily intake of a nutrient that is likely to be without adverse health effects. Okay, so with that, it means if you go over this maximum amount, you may be searching for harm. Okay, a lot of times you're going to see that, you may see that in protein consumption with patients who have kidney disease. You may see that in even for normal healthy people where they take too many fat soluble vitamins, which we'll talk about in a little bit, but fat soluble vitamins, we don't pee out the way that we do water soluble vitamins. So those fat soluble vitamins build up in the body and can become toxic. So we'll talk about those coming up, but that's kind of the tolerable upper intake level. That's kind of your max amount. And then your acceptable macronutrient distribution range, your AMDR. Okay, this is the percentage of protein, fat, and carbohydrates that are associated with reduced risk of chronic disease, provided that there is an intake of other essential nutrients. So this is where we want our macronutrient counts to be at, okay, is our AMDR. USDA dietary guidelines. So these are intended as a primary source of health information for nutrition educators, policymakers, and other healthcare providers. So they're based on scientific evidence that, and they provide information about choosing a nutritious diet, maintaining a healthy weight, achieving adequate exercise, food safety, things like that. These dietary guidelines are updated every 5 years for those USDA dietary guidelines. And then we'll talk here in the next couple slides about MyPlate and about nutrition facts label. So with MyPlate, this is a 5-color food guide that is a visual representation of a healthy meal. Okay, so on this, you can see this picture here. On this picture, you see that red is for fruits, green is for vegetables, orange is for grains, purple for protein, and then a separate blue section for dairy, right? On the side. So the MyPlate website promotes healthy nutrition based on those USDA dietary guidelines for Americans, okay? In food choices and variety, portion size, activity, tools for successful nutritional lifestyle, all of that is encompassed in MyPlate, okay? There's also a My Plate for older adults, and then there's one that's translated in Spanish as well. Okay. And so with the nutrition fact food label, which you'll see on the next slide when I click here in just a second, but you can see this in your book it's in figure 28-2. And so everyone's kind of looked at a food label before, right? So nutrition facts panel contains important information about serving size, numbers of servings per package, total calories, different things like that. Okay. So you can see that in this picture here, and this shows you exactly how to read it. So start here, you're going to look at how many servings are, what's the serving size that these calories and other nutrients are based off of. And then also how many servings are in the entire package, right? Then you go down, you'll see how many calories are in a serving size. And then if you go down, you'll look at these nutrients here. So this is your macronutrients, which we'll talk about with fat, carbohydrates, and protein. Those are your macronutrients. And then you'll see micronutrients, which we'll get into a little bit more. But this just shows you how to break down and read a food label. Okay, so teaching your patients how to do this is going to be beneficial. So as I was saying, nutrients, there's all different kinds of nutrients out there in our food and different kinds of nutrient requirements in our bodies. So nutrients are building blocks for cells and tissues. Okay, they supply energy to our body and they help manufacture, maintain, and repair cells. Okay, nutrients, there's breaking it down a little further. There's macronutrients, like I told you about. So these macronutrients supply the body with energy. So these include carbohydrates, proteins, and lipids. Okay, those are macronutrients. Macro meaning big. They're the big nutrients. Okay, then there's micronutrients. Micro meaning small. So what these do, these help manufacture, repair, and maintain cells. Okay, so these include things like vitamins, minerals, different things like that. The smaller type of group there. Keep in mind too that these are all found in foods that we can intake. We can also take them in supplements, a lot of these different things. Okay. And then these nutrients are changed and used in the body through metabolism, right? Remember, metabolism is how our body takes that food and uses it to function, essentially. So there's two types of a metabolic reaction. So it's anabolism and catabolism. You may remember from anatomy. Okay. So these two things occur continually and they're adjusted according to the needs of the body. So anabolism, I want you to think about anabolism. So that involves the formation of larger molecules from a smaller one. Okay. So anabolism builds it up. It takes a smaller molecule, builds it up to a larger molecule. And it requires energy to grow and build. Okay. So it needs to be fueled with nutrients. Okay. Catabolism, this involves the breakdown. Okay, this is going from a larger molecule into a smaller component. Okay, this process releases energy. Okay, so when nutrients come into the body, anabolism happens to take pieces of those nutrients to build other proteins or other types of tissue or something. Catabolism is going to take that, break it down, and that kind of thing. And they occur continuously. Okay, they occur continuously in the body. So here's a breakdown of those macronutrients that we were talking about. So carbohydrates. So carbohydrates supply energy for muscle and organ function. Okay, they give us quick energy. They are more easily and quickly digested than proteins and lipids. Okay, lipids meaning fat, right? So those are interchangeable terms. So, but with carbohydrates, they fuel strenuous short-term skeletal muscle activity. For instance, exercise, running from a threat of some kind. Your carbohydrates are going to fuel that initially. Okay, it's going to provide, carbohydrates provide nearly all of the energy to the brain. Okay, so you need that carbohydrate, which can be further broken down into just sugar. That's just what it is. A carbohydrate is a sugar. Okay, so sugar, glucose, carbohydrates, all kind of interchangeable terms in supplying the brain with energy. Okay, the brain needs sugar, glucose, carbohydrates. It needs that for energy. That's important to know. Okay, humans store glucose in the liver and the skeletal muscle tissue, and it is stored as glycogen. Okay, so glycogen is then converted back into glucose to meet the energy needs as the body processes happen. Okay, so this process is called glycogenolysis. If carbohydrates are not available to produce that, then proteins and fats are then used for energy. But you get into trouble when you do that too often, which you'll learn as you go throughout this program. And then other physiologic functions. So carbohydrates enhance insulin secretion. Okay, so if you remember, which you may not know a ton of it now, but as you go through this program, you're going to be an expert on diabetes. Okay, and so insulin is that key that's going to unlock and get that glucose into the cell. Okay, so we need insulin because if that glucose cannot get into the cell, it builds up in the bloodstream and it causes all kinds of problems. It wreaks havoc on the body, truly. So carbohydrates enhance insulin secretion. Okay, that's the trigger for insulin to come out is when sugar builds up in the bloodstream, right? It also increases satiety. So that feeling of fullness and satisfaction that you get when you eat a big bowl of mac and cheese. Okay, we know that. And then it also improves the absorption of sodium and the excretion of calcium. Okay. And then proteins, moving on to proteins. So proteins are super, super important for tissue building. You need to know that. That is a basic nursing knowledge thing that you need to carry with you throughout this program, especially when you get into other classes and you start learning about different disease processes, okay? Proteins are responsible for tissue building, okay? It is the structural material of every cell in the body, every single cell, okay? In fact, except for water, protein makes up the biggest part of the body. It is essential for growth, maintenance, and repair of the body's cells and tissues. Okay, so our sick patients that are at risk for pressure ulcers, especially, or skin breakdown, they need increased protein, right? Doesn't that make sense? So when they're at risk, you know, they're immobile. We know that immobility puts them at risk for pressure areas or skin areas, right? So we know immobility does that. We know incontinence does that. So when we've identified that these patients are at risk for skin breakdown, we need to increase their protein, okay? Because that's going to help build that skin back up, those muscles, all of that tissue. It's going to help protect them, okay? Amino acids. So for protein synthesis to occur, every amino acid is necessary to build that protein, and it must be available. Okay. There's complete proteins and there's incomplete proteins. So with a complete protein, these are the types of food that contain all of the amino acids necessary for protein synthesis. Okay. These usually come from animal sources. So we're talking hamburger, pork, that kind of thing. And then there's incomplete protein. So these are foods like nuts and grains. So they have some protein in them, but they don't provide all of the essential amino acids. However, by combining two incomplete proteins, a complete protein may be made. And then all of those amino acids could be there, right? So for instance, if you eat a lentil and some rice, with yellow peppers, that makes it a healthy meal using complementary proteins, right? Or peanuts and black beans in a salad is another good choice. Yogurt with sunflower or flax seeds. These combine different kinds of incomplete proteins to make a healthy, complete protein that is able to fuel that making of the tissue with the proteins and the amino acids, right? Okay, moving on to lipids. So lipids are solid at room temperature. Remember, lipids and fats are interchangeable, okay? They're solid at room temperature and they're called fats, whereas they're liquid at room temperature and they're called oils, right? Fats, oils. We know that it's all a fat, it's all a lipid, right? But when it's solid, it's called a fat. When it's liquid, it's called an oil, right? So for example, butter is a fat, even when it's melted, it would be solid because it would be solid at room temperature. Does that make sense? Butter is a fat, even when it's melted, because it would be solid at room temperature. Okay, you'll hear the terms lipid and fat used interchangeably. That's just how it's going to be. Okay. Key components of lipoproteins. So phospholipids, these contain a phosphate group, which means they're soluble in water. They're a key component of lipoproteins, which consist of phospholipids and a protein, right? Because they are water soluble, lipoproteins are a major transport vehicle for lipids in the bloodstream. So by wrapping triglycerides with water-soluble phosphates and proteins, lipoproteins deliver these substances to the body cells, okay? Also, fat can be used as a backup energy source. Although carbohydrates are the primary energy source during strenuous physical activity, our bodies burn fat for energy when we are engaging in sustained light activity, such as walking or mowing the lawn, and even when we are at rest. The body also burns fat for energy when glycogen stores are exhausted, right? So if you're on a no carb diet or the keto diet, if you've ever heard of that, and you're not taking in any or very, very little carbohydrates, your body's going to switch to burning fat for fuel. And that's when you get that byproduct of the ketones, which is getting a little too complicated for this class. But just know that that can have detrimental effects depending on your overall health status. Okay. So organ insulation and protection also for lipids. So body fat provides insulation, right? It protects the vital organs. It aids in thermoregulation, and it enables accurate nerve impulse transmission. Okay, it's a component of every cell membrane, and it's essential to cell metabolism. Okay, there's multiple types of lipids. You don't need to know them all, but glycerides, sterols, phospholipids, those are all different kinds of lipids. And then there's saturated and unsaturated fatty acids, right? So fatty acids are classified as saturated or unsaturated or trans fats. Saturation means that substance holding all of that. Saturation means that the substance is holding all that it is capable of holding at that time. Okay, that means it's saturated. Makes sense, right? And then there's essential and non-essential fatty acids. So a fatty acid is considered essential if the body cannot manufacture it, which means we need it. It's essential for us. Its absence creates a deficiency disease. Okay. And, that is what makes it an essential fatty acid. Okay. That's all we're going to kind of go into with that. Okay. So let's test your knowledge. So a name brand ice cream contains the following nutrition information for each serving: 30 grams carbohydrates, 19 grams of fat, 5 grams of protein. The total number of calories in a serving would be what? Now, mind you, we have not gone over this yet in this PowerPoint, but you do need to know this part. This is just going to be good knowledge to know going through the program. So this is basic math, okay? Each macronutrient has a certain amount of calories per gram, okay? So as you can see, this is broken down here, okay? It's math. None of us love it, but let's figure it out, okay? So CHO, as you can see in my little bubble here, CHO stands for carbohydrates, okay? That's just a short way to say carbohydrates. So CHO, 4 calories per gram. Carbohydrates hold 4 calories per gram. So in order to figure out total calories of this food, we would just take the 30 grams of carbohydrates and multiply it by 4, right? And then we get 120 calories just from the carbohydrates in this ice cream, okay? Fat is the highest calorie count. It is 9 calories per gram. So to get the fat calories, we're just going to take 9 and multiply it by the 19. And then protein is back down to a 4 calorie per gram. So we're going to take that 4, multiply it by 5, we get 20. We add it all together. This ice cream serving is 311 calories. Okay, that's how you figure that out. All right, so other nutrients. So then we talked about the macronutrients. Now we're going to talk about the micronutrients. So these micronutrients are only needed in small amounts. Okay, so vitamins and minerals are called macronutrients because they're required by the body in small amounts. Okay, although they provide no energy, they are critical in regulating a variety of the body's functions. Okay, so with vitamins, these are organic substances needed for metabolism and preventing a particular deficiency disease, right? So because the body cannot make vitamins, they must be supplied by the foods we eat. They are critical in building and maintaining body tissues, supporting our immune system, and ensuring healthy vision. Okay. They also help our bodies to break down and use the energy found in those macronutrients. They're especially critical during periods of rapid growth, such as pregnancy, lactation, or healing from some kind of trauma. Some evidence supports that certain vitamins prevent chronic illness. And vitamins are either water soluble or fat soluble. Okay. So with the water soluble vitamins, those ones, they dissolve in water and we literally just absorb what we need and pee them out. Okay, so typically you cannot overdose on a water soluble vitamin. With the fat soluble vitamins, they are stored and metabolized in fat in our body. Okay, so with those ones do build up in our body. And if we take too many, it can be harmful. Okay, so the fat soluble vitamins are vitamin A, vitamin D, vitamin E, and vitamin K. Okay, everything other than that is a water soluble vitamin. So minerals are inorganic elements found in nature. Okay, so they occur in foods either naturally or as additives, as well as in supplements. Okay, so major minerals are minerals that the body needs in amounts of 100 milligrams per day or greater. Trace minerals are essential, but they're lower in concentration. So in the United States, calcium deficiency is one of the most common mineral deficiency. Okay, so that's what we're talking about. We're talking about minerals, things like calcium. Okay. And then water. Water is super important when talking about nutrition. So water makes up a large percentage of body weight. Water makes up half of the total body weight in men and half to 55% in women. Okay, men have greater muscle mass. Muscle contains a relatively large amount of water. So men can have up to 65% water in their body. Water is a basic solvent, which means it's a liquid that things are dissolved in. So it is the basic solvent of the body's chemical processes. Okay. Circulating as a component of blood, water serves as a medium for transporting oxygen and nutrients and metabolic waste as well. Water also fills in the spaces in the body tissue, such as in between the muscle. It helps with body structure and form. And then it also helps maintain body temperature. So when body temperature rises, evaporation of sweat helps cool the body. Okay, so hydration is super important when you're sick, right? So energy balance concepts. So basal metabolic rate, or BMR. So this is a measure of energy used while at rest in a neutral temperature environment. It is the energy required for vital organs such as the heart, liver, and brain to function. So your BMR is how many calories are you burning? How much energy are you required to have in order to just make your body do what it needs to do while you're sitting in a chair, just breathing, doing nothing. Okay, if you expend no energy, you're not running, you're not exercising, you're just sitting there. Your basal metabolic rate is just the minimum amount that your body needs just to live. Okay. So look at my bubble here. It's got some important concepts. So energy and nutrients are measured in calories, right? So that BMR is going to be a calorie count. Okay. With your BMR, if you eat how many calories your BMR is, if your BMR, your basal metabolic rate is 2,000 calories and you intake 2,000 calories per day, you won't gain weight, you won't lose weight. If you only intake 1,500 calories, you'll lose weight. If you intake 2,500 calories, you'll gain weight. Okay. So calories in must equal calories burned to maintain your weight. Too few calories or nutrients, you're going to be undernourished or you're going to lose weight. Too many calories, you're going to be overnourished or have obesity. Okay. So when measuring, a direct measurement of that BMR, so typically requires the use of a calorimeter, which this is an insulated unit that measures temperature changes of water. It's rarely used because it requires fasting for 12 hours. But an indirect calculation of your BMR can include, there's calculators online, different things like that. It is most often done for patients in intensive care units in a hospital. We don't typically deal with this on a regular unit. Okay. So factors that affect our BMR, that basal metabolic rate. So body composition. So lean body tissue has a greater metabolic activity than fat and bones. Okay. This explains why women who have on average more fatty tissue than men also have lower BMRs. Growth periods can contribute as well. So your BMR increases during periods of rapid growth, such as the first 5 years of life, adolescence, pregnancy, lactation. Okay. Body temperature, your BMR increases 7% for each 1 degree Fahrenheit rise in body temperature. Okay, that's important for you to know. I want you to put a star by that. Your BMR increases 7% for each 1 degree Fahrenheit rise in body temperature. Okay. So that should tell you that if your patient has a fever, they are losing nutrients. Okay. It's important to be, it's important for them to be hydrated at that point. It's important for them to be nourished, right? Okay. 7%, that's crazy. And environmental temperature. So cold weather, especially temperatures below freezing, they cause a slight rise in the BMR as well to generate body heat and maintain normal body temperature. Okay. All right. So other factors affecting nutrition. Developmental stage. So at specific developmental stages, nutritional needs and eating patterns vary according to the growth, the activity level, metabolic processes, disease prevention, things like that. At specific developmental stages, nutritional needs and eating patterns vary according to their growth, activity level, all of that. So infants are growing rapidly, okay? And then elders are done growing, okay? So a lot of times there's very different needs based on age and developmental status, okay? This includes lactating women. So nutritional requirements increase dramatically in pregnancy as the mother provides for the nutritional needs of the fetus as well. So folic acid intake is critical in the first trimester of pregnancy, those first 13 weeks. This prevents neural tube defects. So a daily supplement of 0.6 to 0.8 micrograms is recommended during pregnancy. Adequate protein and calcium are important for growing muscle, brain, and bone tissues. Iron is essential to maintain maternal and fetal blood supplies and stores during pregnancy. So iron is super important to maintain blood supply in anyone, okay? So just keep in mind, if somebody is anemic, if you know what anemia is, that means their blood counts are low. If someone is anemic, an iron supplement would be necessary. And that's going to keep them from feeling drowsy, tired, exhausted. When you're anemic, those are feelings that you get. Other factors affecting nutrition, educational level. We have to handle our children. We have to educate them because they're not going to make the right decisions based on their own knowledge because they're not as educated. Okay. Same with maybe even adults who have only a certain amount of schooling, things like that. Different knowledge of nutrition. So does the client understand basic concepts and do they have access to that information? Special diets. So if you look on page 958 and on table 28-7, you'll see consistency modified diets. Okay, so there's multiple different kinds of diets that your patient can have on the floor. Okay, so a regular diet, this typically supplies about 2,000 calories per day. Okay, NPO, this means nothing by mouth. Okay. So NPO, you need to know that, just not even necessarily for your test, but that's something that you need to know in nursing. NPO, that means you cannot give your patient anything by mouth for whatever reason. Consistency modified diets are typically used when patients have swallowing difficulties and need thickened liquids. So maybe they have a pureed diet or a mechanical soft diet where it's just about the consistency of their food. Okay, what can they handle? And then diets are typically modified due to disease processes. So for instance, diabetic patients are going to need fewer carbohydrates than other patients, right? And then lifestyle choices. So dietary patterns. So the type of food consumed is as important as the amount of food to a person's overall health. Okay. Also, physically demanding work can cause fatigue and affect the quantity and quality of food consumed. So when time pressure makes it difficult to prepare and eat healthy food during a short lunch break, some people rely on convenience to save them time. Also, up to half of the water-soluble vitamin content is lost in the cooking water of boiling vegetables. So cooking methods can contribute to that as well. So keeping foods hot longer than 2 hours also results in even further loss of those nutrients. Oral contraceptive use, it can lower the serum level of vitamin C and several B vitamins. So women with marginal nutrient intake may need to take vitamin supplements. And then some people who use food to relieve stress, right? So food is commonly used to cope with stress, depression, loneliness, boredom, right? Skipping meals or binge eating or consuming too much of one food like snack foods or chocolate. This can all result in poor nutrition and obesity and low self-esteem. And somebody can be obese and extremely nutrient deficient as well because of the quality of their food. Tobacco use. So smokers use vitamin C, an antioxidant, faster than non-smokers. Okay, the more a person smokes, the more vitamin is lost and the more the body needs. Right? Alcohol. This contributes to obesity as well. A 12-ounce beer contains 150 calories. A juice-based cocktail contains about 160 calories. And alcohol significantly decreases the rate of fat metabolism. So excessive alcohol use interferes with adequate nutrition by replacing the food in the person's diet because they're full of beer or booze, right? It depresses the appetite. It decreases the absorption of nutrients by its toxic effects on the intestinal mucosa as well. And then it also impairs the storage of nutrients. So people who use alcohol heavily need multivitamin supplements, especially B vitamins and folic acid. Also caffeine. So many of our accepted beliefs about the danger and benefits of coffee are myths. Coffee does not create a risk for dehydration or heart disease or cancer, and it has a little role in hypertension. Caffeine may be associated with bone loss. However, its negative effect can be offset by a small amount of milk. Okay. In high doses, we know that caffeine can cause some anxiety and stomach upset, right? But it can also boost mood and mental and physical performance, as we know. Vegetarianism. So semi-vegetarianism, this is the most inclusive. So it allows fish, eggs, and dairy products. And then there's different kinds of vegetarians. Some allow fish, some don't. Some are pescatarian. The big thing with vegetarians is we want to educate them to make sure that they're getting enough iron in their food. Okay, like we talked about, iron for anemia is super important. When you're not eating meat is an excellent source of iron. So a lot of times with vegetarians, if they're not being conscious of their iron intake, they will be deficient in iron and they will then be anemic. Okay, so we need to educate them on that. And so eating for health. Right? So a diet high in meats, fish, fresh fruit, vegetables, nuts, seeds, eggs, other natural whole foods, that is biologically healthier than the modern diet, right? So we want to make sure that we are incorporating all of those different kinds of food and avoiding lots of processed foods, like snack foods, packaged foods, refined sugar, that kind of thing. Eating for weight loss. So many diets, including the DASH diet, if you've ever heard of the DASH diet. So the dietary approaches to stop hypertension, that stands for DASH, the DASH diet. It's nutritionally sound. And that one is something that they put on patients who have hypertension or pre-hypertension. And it focuses on low sodium. Okay, because when a patient has hypertension, sodium is going to shoot their blood pressure up. So we always want to restrict or control sodium intake for these patients. Okay, so there's that. Then there's ethnic, cultural, and religious practices as well. So food choices often reflect foods that were plentiful in the region of origin, right? So if they're from a coastal community, they would eat a lot of fish, coffee, and cocoa beans in places near the equator. As well as foods that are readily grown in their native soil. So rice, if they're from a warm wetland, or potatoes in colder climates, things like that. So we have to consider that as well. There's also many religions that won't eat meat or won't eat different kinds of things, or the Jewish religion, they have to have everything kosher. So we need to be mindful of that. And then we need to consider that chronic diseases can alter nutrient intake, digestion, absorption, use of the nutrients, and excretion of them, right? So any illness, especially when accompanied by a fever, is going to increase that need for protein, water, and calories to meet the demands of the increased metabolic rate, right? Because it goes up 7% for every 1 degree, right? So they have to take that into account. And then medication. So in addition to the direct effects of diseases and disorders, their nutrition may be affected by their medications as well. So a lot of medications can not be taken with grapefruit juice, right? Because that can just totally interfere with that. So that's important to know. All right, test your knowledge. Excuse me. So let's identify the client with the greatest risk for developing a protein calorie malnutrition. Okay, so a client who has multiple sclerosis and it's in a wheelchair. B, a client weighing 300 pounds who has entered the hospital for cardiac bypass surgery. C, a client with a broken arm and femur from trauma who is running a fever of 101.5 degrees Fahrenheit. Or D, a client who is of Native American heritage. The correct answer is C. This client would have the greatest increase in metabolic demand for energy, right? Because they've experienced trauma, a broken arm, and a broken femur, and they have a fever. So all of those things increases their metabolic demand. They need that protein. They need that calories to repair their body. Okay. All right, so screening for nutritional problems, right? So this is going to be our part of our assessment, right? A part of our nursing process, our assessment. We're going to obtain a dietary history. So when we're taking a diet history, whether we are using self-administered form or an interview or whatever we use to collect knowledge about our patient, we're going to ask about their basic eating habits, their food attitudes. How do they feel about certain foods, their preferences, any cultural factors and dietary supplements, right? We would maybe ask them to do a 24-hour recall. So this is us asking them to name all the foods they've eaten within a day. Okay. What did you eat for breakfast, lunch, dinner, snacks? And then they're going to let you know. It's simple, it requires no equipment, and it can be used as often as required. However, the accuracy of the data may become questionable because some people have difficulty remembering and things like that. Then there's a food frequency questionnaire. So this asks the client to identify the number of times per day, per week, or per month a particular food group has been eaten. So how often do you eat fruit? How many times per month do you eat red meat? Okay. That is the food frequency questionnaire. And then a food record. So this is the most accurate. This is like a food diary. It provides information on the quantity as well as the types of food eaten. And it's where we ask the client in advance to keep a record of measured and weighed amounts of all food he or she eats in the 3-day period. From that information, we can analyze the total number of calories and symptoms as well. Okay. All right, so identifying nutritional imbalances again. So then we move on, we've done our food history. Now we're moving on to our complete physical examination, right? So that's again, part of our assessment and our ADPI, our nursing process, right? Complete our physical exam. We're going to do a general survey. What do they look like? Do we notice that they look malnutrition? Are they overweight? Do they look like they feel bad? Do they look like they have energy? Do they look clean? It's just a general survey. We're going to look for alterations in vital signs. Okay, that's another thing that we're going to look at. Do they have hypertension because they're overweight? That could be fixed with nutrition, right? Poor skin turgor, which again, I know that I've mentioned this before. We'll talk about this in our physical assessment, but skin turgor is a test of dehydration. Okay, so that's where we pinch up the skin on either the hand or the chest, and we see if it tenses. And if it tenses, then that means they're dehydrated. And and tenting means it stays pinched up when you let go. If they are adequately hydrated, when you let go, the skin will go back to its normal spot. So poor skin trigger would mean they're dehydrated, okay? Poor wound healing would mean that they're nutrient deficient, right? So if they're not getting enough protein, their wounds are not going to heal, okay? So that's gonna be something that should spark your attention there. A concave abdomen or ascites. So with a concave abdomen, that just kind of looks like they're sucking in their belly all the time because they're so nutrient deficient. They're so thin, they're so malnourished. And then ascites is something that is like super swelling in the abdomen. So it almost makes somebody look pregnant, okay? And so a lot of times you'll see that in liver failure, okay? Alcohol use as well, things like that. And then a change in muscle mass, okay? Laboratory results, so changes in blood glucose. So remember, blood glucose levels indicate the amount of fuel available for cellular energy, okay? Cells need that energy of glucose. Levels above a normal set point trigger the release of insulin, right? Which causes the glucose to move into the cells, and then they can be stored in the liver and the muscles. Okay, a level below the normal set point triggers the release of glucagon, which that leads to the release of glucose from storage. Okay, serum albumin. So this is just regular. Serum always means blood count. So when you're hearing the word serum, it means in the blood. Okay, so serum albumin is synthesized in the liver, and it constitutes 60% of the body's protein. Albumin. Okay, remember that albumin is a type of protein. Low levels of albumin are associated with malnutrition, malabsorption, acute and chronic liver disease, and repeated loss of protein through burns, wounds, other things like that. Okay. Prealbumin. Okay, so these are two separate things. So prealbumin, this is another marker that's good for indicating nutrition deficiency. It has a shorter half-life than the albumin, okay? And it's considered a better indicator. You need to know that. Prealbumin is a better indicator or the best indicator for noticing malnutrition, okay? Because it has a shorter half-life than serum albumin. So a half-life it's the time that it takes for half of this. Typically you see half-life used in relation to medication. So half-life is the time that it takes for half of the medication to be out of the system, okay? So with prealbumin, it has a less of a half-life than albumin, which is why it's a better indicator of malnutrition, right? Creatinine, so this is an end product of skeletal muscle metabolism, and it is excreted through the kidneys. So this is typically a lab that we will draw to check kidney function. Okay, it's a great indicator of renal function. Increased levels indicate impaired kidney function and a loss of muscle mass. Okay, and then hemoglobin. So this is composed of heme, which is an iron-rich compound, and globulin, which is the serum protein, right? So that's hemoglobin. Adequate iron intake is required to produce hemoglobin, right? So therefore, low hemoglobin may indicate inadequate iron intake or chronic blood loss. Okay, so that's again going back to that patient having anemia. And if you don't have that hemoglobin, your body and your tissues are not as well oxygenated as they could be, okay? Because that hemoglobin provides oxygen, okay? And you need iron to make hemoglobin, okay? So that just kind of comes full circle with that. Eating nutrient specific. So you need to know this slide. Okay, you have to know what foods are appropriate to recommend to your patient if they're nutrient deficient. Okay, so this is important to know. So bookmark this slide. So potassium, good sources of potassium, bananas, peaches, potatoes, molasses, avocado, milk, and shellfish. Those are all foods that are high in potassium. So if your patient is low in potassium, we want to recommend those foods. If your patient is high in potassium, we want to say, please don't take these foods. Please do not eat these foods, okay? Sodium, foods high in sodium, eggs, baking soda, fried food, seasonings with added salt. Okay. Foods high in phosphorus, dairy products, wheat bran, beans, sardines, and chicken. And then foods high in calcium, dairy products, egg yolks, nuts, and broccoli. Okay. And so we'll talk a little bit about overweight and obesity. So those two things together affect 2/3 of our adult population and are associated with chronic diseases such as diabetes, hypertension, coronary artery disease, stroke, gallbladder disease, gout, and obstructive sleep apnea. Okay, big deal. So a person who is 40% overweight is twice as likely to die prematurely as a normal weighted person. Therefore, as a nurse, you can assist your clients to achieve and maintain a healthy weight. So we want to make sure that they are consuming the appropriate nutrients. We want to make sure that we are maybe calculating their BMR and telling them this is the amount of calories that you need to eat less than in order to not gain weight, in order to lose weight so that you can be healthier, right? And so that BMR is more needed for more activity, gender, height, and weight. So all of that is just dependent on, your BMR is dependent on all of those things. And then you'll see down here, this is a BMI chart in my little bubble here. So a healthy weight, a healthy weight is, the BMI is between 18.5 and 24.9. Okay, so anything less than your BMI is, it's not the best. It's really not the best, but it's what we have right now. And we use it in nursing. So a BMI less than 18.5 is going to be an undernourished person. Okay. Anything above 24.9 is considered pre-obese all the way up to obese class 3, as you can see per this chart. Okay. Underweight or undernutrition. So underweight, this is the cause of underweight status may be a variety of things. Okay. It could be hospitalization, could be self-care deficits. Maybe they can't feed themselves very well. Maybe it's illness. Maybe they have an eating disorder, right? A person can also be malnourished with regard to specific nutrients without actually being underweight, right? Maybe they have difficulty chewing or swallowing, so decayed or missing teeth or ill-fitting dentures. All of this is going to make chewing difficult, right? A person often resorts to eating only soft foods, which lack a lot of fiber, okay? Acute disorders making the throat hurt, such as pharyngitis, right? A sore throat. Makes swallowing painful, makes people eat less. Cancer of the throat can also cause strictures, which is where the throat is too tight, which makes it difficult or painful to swallow. All of these can contribute to undernourishment, malnourishment, right? And then alcoholism. A poor appetite results in decreased intake of food and therefore nutrients. This is a common problem in alcoholism. They don't eat very well because they're full all the time. Then they become malnutrition. Malnutrition. I don't even know if that's the correct term. And then metabolic disorders as well. So diabetes, mellitus, gastrointestinal disorders. These can all alter nutrient intake, digestion, absorption, excretion. Any illness, especially when accompanied by a fever, is going to increase that need for protein, water, and calories to meet the demands of that increased metabolic rate. Okay, same with traumatic injuries like burns, surgery, that kind of thing. Pressure wounds. Okay, that's important that when you think pressure wounds, you're always thinking nutrition and you're always thinking protein. And so this is about calculating BMI. So this is on page 963. So this can be calculated exactly with equipment. However, it's mostly done with this calculation that is on this page here. So there are also height and weight charts with the calculations predetermined. In the hospital, like an EMR would do it for you. Okay, just keep in mind a normal BMI for an adult is 18.5 to 24.9. Okay. BMI accuracy may be limited to athletes. Okay, they have larger muscle mass, so might not be as accurate. Pregnant women, older adults, things like that. That's why it has its limitations. BMI has its limitations. However, it's generally useful in identifying underweight and obese individuals. Okay, so you can see here on this box 28-3, you can find this in your book. This is directly from your book. So with calculating the BMI, the math equation is here if you want to review that. So test your knowledge. You are caring for an adolescent who has a BMI of 36. So what do you think could cause this patient's obesity? List at least 5 possible contributing factors. And then what are 5 possible physical and emotional consequences for this adolescent with class 2 obesity? So obesity is a complex health issue with many causative factors, including genetic factors or family predisposition, dietary intake. They're eating more than they're using, right? The habit of overeating, the habit of binging, poor quality food, processed food, vending machines, fast food, snacking, things like that, sugary drinks, sugary cereals, that kind of thing. A sedentary lifestyle, high amounts of screen time or low amounts of physical activity. Maybe a medical condition. Maybe they're on medications like steroids can often increase, can cause weight gain. It can cause a ravenous appetite. Some psychiatric drugs as well can cause weight gain. Antidepressants, some of those can cause weight gain. Or learned behaviors or emotional eating. So depression, or when it was a reward for good behavior, or comfort when feeling sad or lonely. And then physical consequences that they could, that this patient could have from class 2 obesity. So diabetes, heart disease, hyperlipidemia, which is high cholesterol, hypertension, high blood pressure, sleeping problems, breathing problems, asthma, shortness of breath, mobility issues, joint pain, skin problems, infections, cancer, stomach cancer, liver cancer, gallbladder cancer, all of these things. Those are your physical consequences, potential. And then emotional consequences, reduced self-esteem, loneliness, social isolation, depression, anxiety, OCD with binge eating, things like that. So let's test your knowledge. The nurse knows the lab result that is the best indicator of a client's nutritional status is the serum albumin. Is this true or false? It is false. The latest research shows that the pre-albumin has a shorter half-life than albumin and is a better indicator of protein stores. All right, moving on in our nursing process. So key point, we must identify the etiology, which is the cause of the imbalance. Okay, etiology, you'll see that a ton. Etiology means the cause. What is happening in the body that is causing this imbalance, right? So examples of etiology for undernutrition, difficulty chewing or swallowing, like we talked about, alcoholism, metabolic disorders. Examples of etiologies for overweight or obesity, overeating, lack of exercise, endocrine problems, okay? Healthy People 2020 is an initiative that was created with the goal in improving health status overall. Okay, you will get into that, especially when you get through this program into different clinicals and your service learning, which we will talk about. But you just need to know that that's what it is. Okay, and then promoting health and reduction of chronic disease associated with diet and weight. That's our goal. And then our interventions. So what are you going to do about it as the nurse? Our nursing interventions. Remember, we're going right through that add pie, right? Okay, so we need to do client and family teaching related to lots of things, okay? Vitamin and mineral supplements. We need to tell them what's appropriate, what's not, what do they need, what do they not need. We need to teach them how to obtain nutritious foods on a limited budget. That's a big one. So for older adults in the United States, 2 types of food programs are available for you to recommend. So everyone older than 60, regardless of their income, can eat hot noon meals at a community center, right? So those who are ill or disabled can receive meals at home under the home delivered meals program. So those are definitely available. We also can talk about coupons. Coupons are big ones, or food drives. We can point them towards food drives, or like the Salvation Army. A lot of times they'll have a food pantry, things like that. And then we want to support special clients' nutritional needs. So clients who are NPO, which you remember means nothing by mouth. Okay. So if you have patients who are NPO for tests or procedures, we want to make sure that they're scheduled early in the day so that we can decrease that length of time that they must not eat. If testing must be late in the day, we want to ask the provider whether the patient can have an early breakfast, right? Older adults, we want to advise them to eat nutrient-dense foods and to eat essential foods first, right? Eat your protein first, because that sense of taste is decreased. Older adults may prefer those concentrated sweets, and because they may also have a poor appetite, once they eat the sweets, they may not be hungry for everything else. Patients with nausea or impaired swallowing, this may adversely affect nutritional intake and need to be addressed in the plan of care. Maybe add anti-nausea medicine by talking to the physician. Giving them peppermints, that can help with nausea as well. Impaired swallowing, we want to add things in the plan of care that's going to help them take in this food. Patients with impaired digestive function, so nutritional health is due in part to digestive function and chewing and passing stool, right? So dysfunction of any of those parts can reduce all of that functioning. Okay. And then assisting clients with meals. So inpatient, we can delegate feeding patients to our CNAs or our nursing assistant personnel. That can be delegated. We also need to know how to do it, because if our personnel is busy or we have the extra time, we should be feeding our patients as well. It's important to feed your patients slowly, especially your patients with swallowing issues, because they tend to pocket food in their cheeks. So we want to make sure that they're not doing that, because then they are at risk for choking, right? So feed them slowly. If they have deficits like visual deficits, maybe they're blind, we want to let them know what they're about to take a bite of before they take a bite, right? Give them frequent drinks. And then some interventions for obesity. So we want to assist with calorie calculations and meal planning. We want to encourage exercise and lifestyle changes and suggest that they weigh weekly, suggest a food diary. And then for undernutrition, encourage a client to seek counseling for eating disorder management, devise strategies to improve a client's appetite, enteral nutrition. So we'll talk about that on the next slide a little bit more about what that is. And then parenteral nutrition. So let's chat about that. Okay, so enteral and parenteral nutrition. Okay, so enteral nutrition. This is when nutrients are directly placed into the intestinal tract. So a tube feeding, okay? A tube feeding. If you've ever seen a G tube directly into the stomach, that is an enteral nutrition, okay? This can be short or long-term depending on the need. This is preferred for patients that have a functioning intestinal tract. Okay, there's a lower occurrence of sepsis in enteral nutrition, and it maintains intestinal tract function as well, right? So for these patients that are receiving enteral nutrition, we need to monitor for tube placement. So you will learn that skill in lab, okay? But we monitor for tube placement because if it becomes dislodged, it can cause problems, okay? We want to make sure that the tube's always in the stomach, and there's a risk that it could get into the lungs with an NG tube, right? So an NG tube is enteral nutrition, right? So that's why you're checking placement, because you could accidentally get it into the lungs, and we don't want to put feeding directly into the lungs, okay? It needs to go down that esophagus and into the stomach, right? So we have to monitor for tube placement. We have to check their skin condition, make sure that if it's a G tube and they have a surgical opening, that it doesn't look infected. We check their laboratory values, especially their glucose, right? Their BUN, which is another indicator of kidney function, and we check their electrolytes as well. This allows us to detect complications that affect metabolism or fluid and electrolyte imbalance. right? Sometimes feedings may need to be increased or decreased depending on the patient's changing clinical condition. So risk factors with enteral nutrition. Aspiration, remember we talked about that. That's where that fluid goes, or feeding or whatever goes into the lungs. That's a big risk factor for these, and that's why it's so important to check placement. Okay, and then NVD, nausea, vomiting, diarrhea. Okay, and these enteric nutritions can be administered at home. And when comparing to parenteral nutrition, so parenteral nutrition is occurring directly through the venous system. So they have essentially a large central venous catheter, right? So that goes directly into the heart, and they receive almost like an IV fluid that has nutrients just dissolved into this IV fluid, and it is their only way of getting nutrients, okay? So otherwise known as total parenteral nutrition, okay? TPN, that's important for you to know what that is, okay? TPN, total parenteral nutrition, that is that IV fluid. It's a bag of fluid, and it's got all kinds of stuff in it. It's got electrolytes, it's got minerals, it's got vitamins, it's got protein, you can add fat to it if your patient needs that. It's everything. It's everything, okay? So these patients typically are not eating anything by mouth, which the enteral patients may not be either. It's all just dependent on their diagnosis. Okay, so this is the preferred method. Parenteral nutrition is the preferred method for patients with GI tract issues, or if they require high nutritional needs due to some kind of health condition. Okay. Like I said, it contains a specific formula created from the patient. So it's literally tailored to their nutritional needs. So we draw a lab every day or every couple of days, and then somebody, the physician, reviews their lab values, and then the pharmacist adjusts that formula to what the patient needs and doesn't need. Okay, and then like I said, you can add lipids in there as well. So this is dosed by a pharmacist, okay? So with these patients, it's super important to monitor serum electrolyte levels. We want to monitor urine for sugar, skin turgor to see if they're hydrated, that kind of thing, okay? The patient's prescription for what they need in that is written in the morning by a physician, then sent to the pharmacy. Okay, and then when parenteral nutrition arrives on the unit in the evening, it has to be double checked by 2 RNs, just like blood. Okay, and then it's hung using a new tubing and filter, which is very similar to administering blood. Parenteral nutrition is very, it's very important. It's very important. Okay. These patients are at high risk for infection because they have that central venous catheter, right? In a long-term, it's a long-term thing typically. And they're also getting high glucose concentration through that large central vein. So I want you to always think about glucose, and sugar breeds bacteria. Okay. That's why people with diabetes are often at high risk for infection, because high sugar breeds bacteria. Okay, so always think about that. So that's why a high risk of infection. It's also important for you to know, as you're giving this total parenteral nutrition throughout the day, if it runs out during the day, which means their bag is empty, what do we need to be thinking about if that patient cannot eat anything by mouth, and their parenteral nutrition, which it's typically hung and infusing all day long? That's typically how it goes. You typically have it going all the time. But what if yours runs out early and you don't have another bag? What do we need to be thinking about? So what your first thought needs to be is that your patient's going to have low blood glucose, right? Because that their only supply of sugar is that parenteral nutrition, and now it's run out, right? So we'll need to supplement that missing sugar with the same level of glucose that was in that parenteral nutrition in some way, whether it's an IM injection or whether it's through the IV. So that's something that you need to be thinking about for sure if that fluid runs out. And here's just some examples of enteral access, right? So short-term enteric feeding options. So typically nasogastric, right? An NG tube from the nose directly into the stomach, or an NJ tube, which is a nasojejunal tube. So that's from the nose into the jejunum of the small intestine. Long-term, typically they're placed using radiologic or surgical techniques. Okay, so you can see this, you can see where the NG tube is, and you can see a visual how it goes right directly into the stomach. And then you can see, oh yeah, they show nasogastric, nasoduodenal, which goes into the duodenum of the small intestine, and then the nasojejunal, right? And then there's gastronomy options. So that's what we're talking about when we talk about an actual feeding tube that is surgically placed. So a PEG tube, that'll show you where that is. A PRG tube, a PEJ tube, just a regular G tube. These are all kind of listed on here. So that's kind of a nice little visual for you. And then parenteral nutrition. So this is usually given through either a PICC line or a central venous access device due to its high glucose content, right? So it's for long-term nutrition needs, provides all necessary nutrients, and it's delivered through a large vein in the arm, neck, or the chest, as you can see here. So peripherally inserted central catheter or PICC line. You see it right there, going in right into the superior vena cava. Okay. Yeah, and that's really all you need to know about that. Okay, all done.